Welcome to Advancing Health. At a time when reliance on life-saving drugs plays a more important role than ever in patient care, nearly one-third of America's pharmacies have closed since 2010. In today's podcast, we learn what one forward-thinking health system is doing about it.
Hi, everyone. This is Dr. Chris DiRienzo. I'm the Chief Physician Executive for the American Hospital Association. Welcome to this episode of our Advancing Health podcast. We haven't had a chance on this podcast to talk about the crucial role that pharmacies play in caring for people, for patients all across the country. But today is the day. I am very excited to welcome John Pastor. He is not only the president of Fairview Pharmacy Services, he is also a pharmacist himself. And I'm excited to welcome John to the podcast because we have a lot of learning to do around pharmacies and the challenges that folks are facing with access in the country. So, John, welcome to the podcast.
Great. Thanks so much for having me.
And Fairview actually is a health system who just won one of the AHA's most prestigious awards, the 2025 Foster McGaugh Award. And John, thank you for joining us and congratulations.
Thanks so much. I can speak on behalf of Fairview Pharmacy Services and Fairview Health Services and just say how proud we are to be the 2025 recipient of this award and what it means for us in serving our communities.
John, I wonder, maybe we can start our conversation with just giving listeners a sense of the roles that pharmacies play in the access continuum to care and perhaps even locally to you all up in Minnesota.
In some instances, the pharmacy is the first point of healthcare access for many people. It's the point of healthcare that they access most frequently, oftentimes more than they're seeing their primary or specialty care physicians, and certainly more than they're seeking hospital care in most cases. The concern is that we've seen pharmacies all across the country close at an alarming rate. And so access is a challenge for many, even in some large urban and metropolitan areas, not just in our rural communities.
You're exactly right. There are some numbers around that between 2010 and 2021, nearly 30% of pharmacies around the country closed. And I spend a lot of my time on the road. And sometimes, if you're visiting a small town in rural America, there might only be one pharmacy. And so if that closes, we're talking about not just access to care, but access to medications.
Yeah, that's correct. And I think in the state of Minnesota, we've seen that number be even higher for independent pharmacies, a little bit lower perhaps for our chain pharmacy partners. But that number is just alarming. And there's certain parts of the state where people may have to drive, 40, 50, 60 miles to get
Wow.
to a pharmacy in some cases.
That's a multi-hour round trip just to get the prescription for your heart medicine or your neurologic medicine. And we know that with America's aging population, the number of Americans who are on one or more drugs only continues to go up.
Drug therapy continues to grow every year as more and more new, medications are identified and approved by the FDA for use to treat conditions that in some cases couldn't be treated before. So drug therapy continues to increase as sort of a mainstay of treating many both acute as well as chronic diseases.
I'm a neonatologist, and you couldn't be more right. There are things that we can treat today that 10, 20, 30 years ago were not problems that we could help patients solve. But in order for the medication to work, first you've got to be able to take it. And again, this is not only a national challenge, but one it sounds like that has been particularly acute where you all are located up in Minnesota.
Yeah, that's correct.
Well, tell us a little bit about the challenge that specifically your health system faced, and where did you turn to try to begin solving that challenge for the communities that you serve?
Well, we started with pharmacy services in our system back as early as 1990 when we had our first retail pharmacy in Edina, Minnesota, and we were providing retail pharmacy services and home infusion services out of that pharmacy. But over the last 35 years, the business has grown and clearly has transformed quite some time ago from being, a prescription dispensing business or medication dispensing business to a provision of care and focused on outcomes business. So not only has our volume grown over 35 years, but the scope of our work has grown exponentially in how we contribute to the care and the outcomes of patients. Frankly, we had to build a new central services facility for our corporate pharmacy location, which houses Many of our central pharmacy functions, including our specialty and mail services pharmacy, our home infusion pharmacy, our compounding pharmacy, and our wholesale pharmacy, because that growth was occurring at such an alarming rate, we simply didn't have the space to continue to expand.
That is a wide range of services that you're describing. When I think of pharmacy, it's I get a prescription from my doctor, I go to the pharmacy, it comes in a little orange, pill bottle, and then I bring it home. But you're describing what sounds like a much broader range of services that your patients are needing, and it sounds like struggling to find access to elsewhere.
Correct. And what I didn't even include in those numbers is we have 26 retail pharmacies in our community, and we also provide the pharmacy services across our 11 hospital locations.
Wow. So let me rewind for a second. You operate 26 retail pharmacies totally separate from the hospitals. And then you have the internal pharmacy as well that not only, I imagine, provides the medications that hospitalized patients need, but then offers some connectivity to when they get discharged.
Correct, correct. And a point of clarification, some of those retail pharmacies are actually located in our hospitals and serve as a discharge pharmacy as well as a community pharmacy for people that live in the area.
Fascinating. I haven't heard of this model being, deployed at this level of scale too much around the country. What prompted you all to go down this road and how is it going?
Say first, it's going very well. As I mentioned, we continue to grow from both a volume and a scope year over year, and that's in part just due to organic growth internally within our health system, but also, as we talked about earlier, just the pressures in the community with access to pharmacy services from some of our, other pharmacy partners out there. But the growth has continued year over year, and we've had to continue to evolve and change our footprint and expand our footprint in many cases in order to meet the needs of our patients.
And so when you're planning for those needs, because these kinds of physical plants, for lack of a better word for them, they don't just magically pop up overnight. It takes a lot of planning and effort and logistics to make them happen.
The previous location that we were in from a central services facility, we had been in since 2001. And I think we actually started with about 15,000 square feet. And by the time we started our move this fall to a new location, we were using at that original location about 105, 110,000 square feet. So that's over the period of about 23 or so years. The location we moved into, we built with intention based on our current and anticipated future needs as a 150,000 square foot facility, and we're using a little over 90% of it right now, with the rest of it being intentionally shelled out for strategic growth in the future.
Goodness. You're already at 90% capacity within this brand new space that you've built.
And it's built again with intention. So it's built for efficiency and designed to make it convenient and accessible for patients that come here, but as well our staff who do a lot of work inside the four walls.
We were talking about this a little bit earlier that it's an interesting space for a health system to be in. When you're talking about sort of the core of hospital and even ambulatory services, operating pharmacies at this scale and the production needed to go into that is fairly unique. But you all obviously have a firm belief in why this is a space you need to be in.
We've learned over the years that it's important for us to provide all the pharmacy care for our patients. Keeping our health system patients within Fairview is very important from an outcome standpoint, a patient satisfaction standpoint, and frankly, it makes it easier for our providers to do their work too. Our physicians and our advanced practice providers being able to, have access to the records that our pharmacies keep, as well as us be able to see the records that they have in the electronic medical record.
Well, it's certainly a worry that I have had, as a neonatologist, if you're discharging a baby home and they need to be on, multiple medications, which frequently they're not on for the rest of their life. But if they're not taking it in those immediate months after discharge, it can be pretty challenging. But getting access to was the prescription filled? Was it then dispensed? Are they taking it? Are they refilling it? That can frequently be challenging to secure. You want to avoid that patient not being able to access this one medication that without it ultimately leads to them needing to be hospitalized again, right?
Yeah, and a great example I could give you is a physician discharging a patient from one of our hospitals can send a referral to our home infusion team. Maybe that individual needs antibiotics, maybe they need IV or parenteral nutrition for some period of time, and they have access to all of the records that the pharmacy has in terms of progress notes, notes that the nurse who goes into the home and completes the infusion would put into the record. And so that type of, I'll call it seamless care for the patient, but as well as our providers too, being able to have that level of seamless sort of transition is important.
Well, obviously, y'all have done an enormous amount of work to build this program and to serve the community the way you are. Looking through the windshield, where do you see your efforts continuing to go over the next several years?
I think our primary focus over the next several years is to continue to build in processes that we can automate. And by that, I mean, we've already done a really good job, I think, automating our dispensing process at our new facility. We have some state of the art equipment. More importantly, we have a lot of, I'll say, kind of behind the scenes functions that need help with even further automation. So our business office, our revenue cycle team that manages that, folks that do prior authorizations with our payers and insurance companies. Many of those things we need to continue to further automate to make it more efficient so we can handle the growth and the volume that we expect to continue to get.
Yeah, I mean, it sounds like a demand that isn't going down anytime soon. And recognizing that a lot of our listeners are folks who are operators in hospitals today, what one piece of advice would you give to them when they're looking at the needs of their community and they're saying, man, what the folks at Fairview are doing to close this pharmacy gap makes a lot of sense to us, but I want to learn more. What would be your first point of reference for folks to learn more about how they might could bring a similar service to their community?
Yeah, that's a great question. I think first and foremost, making sure you're meeting the needs internally for your internal patients, right? Make sure you're able to capture and provide all the pharmacy services that your internal health system or hospital patients need. But then doing a community assessment. What's the unmet need in your community? Where are those pharmacy deserts, as they describe, where people just don't have access to a community pharmacy? And I'll add one other layer to that is where people don't have access to a specialty pharmacy or home infusion or infusion services. Those gaps exist too. And frankly, we fill a lot of specialty medications for patients outside of our health system. From the specialty pharmacy standpoint, it's nearly half of our prescription volume comes from external to our own health system, much of it locally, but actually across all 50 states in the US.
All 50 states.
All 50 states, yep.
You heard it here first, folks. Up in Minnesota, they are serving the folks in Alaska and Hawaii. That is fascinating. Well, John, this has been a real privilege. Again, thank you for helping me and our listeners learn more about the role that access to pharmacy and pharmacy services plays in the community. Congratulations on everything that y'all are doing. We can't wait to stay tuned and hear how it keeps going.
Well, thanks so much for having me on. It's been great talking with you today.
Thanks so much.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.